you today. So I think that will be helpful in allaying your fears of what the end of the OSCE looks like. We also need to demonstrate, I'm going to demonstrate the cardiac assessment as well as the abdominal assessment today. I'll demonstrate that, and I think you should practice both today. And then for your SOAP note today, I'm going to give you several different options they won't take long to demonstrate. Do you have your lab down? If a woman has large breasts, you have two options. May I put the stethoscope on your breast? Is that okay? May I displace your breast? Use the back of your hand, lift it up, listen to your PMI, your lung sounds, whatever you need. Or you ask them, do you want to displace your breast with your hand while I listen? You give them choices. And you ask if you can untie the gown or if they would like to untie the gown. But you have to do stethoscope to skin for good technique. All right, so I'm gonna go get her, and I need a pen. Oh, and then they'll give you a findings card at the end. After I do my exam, they'll give you things to touch. I mean, they might touch and they might go, ow, but then you might do sharp and dull discrimination, and they'll give you a card at the end that says, I could not feel the left outer part of my body. And then you'll go, oh, okay, there's a deficit there. That's just an example.
So those cards come at the end, not as we're doing it?
Right, because the actors, like, it's kind of hard, because if they give it to you too soon, then it might give you an answer that you didn't do.
Yeah.
So we have it at the end. You run through the exam, everything you would do for back pain. You do muscle strength testing, you do sharp and dull discrimination, you do straight leg raise, you would do, paraspinal and spinal tenderness, and you do it all. And then you get the finding card that says, no sensation, whatever. So you just run through it. And then they may give you a card that says everything's normal. And then at the end, because this is health assessment, you don't have to know you have to have a general idea of a diagnosis, but you don't have to have a plan. So you're not going to say to the patient, oh, you have a UTI, I'm going to give you Cipro 500 BID for 3 days. All you have to say is, wow, okay, I see some tenderness to your back and that you can't feel in the outer part of your leg. I will go tell my findings to my preceptor, and we'll be back in with a plan. You can just end it that way.
Okay.
So summarize a little. You could say, is there anything else you want to tell me? And then you'll say, I'll be back. That's the only class you can get away with that. Once you hit the next one, 592A, and they have, like a sinus infection, then you have to say, I'm going to give you a CPAC for 5 days or amoxicillin, 500, whatever. So,
hi.
Hello. Long-time actors, so she's just wonderful. So, does somebody want to time me? So I've had my 5 minutes to look at my case. I've used my common symptom guide, and you will be timed and videotaped. So
do you get like a time warning?
you get a 5-minute warning that after 15 minutes they knock on the door and say 5 minutes. So when if I take too long, will someone give me a 5-minute warning?
Yeah.
Okay. Okay, you ready?
Yes.
Are you ready? Okay. Knock, knock, knock. Come in. Hi, how are you?
I'm okay. We're better.
We're better. My name's Amanda Thurman. I'm a nurse practitioner. I'll be seeing you today. There's no sink in the room, but there is hand gel, so you have to hand gel your hands. Okay. I'll be doing your visit today, Jerry. What's your name? Jerry. I already know her name is better. Okay, Jerry. I'll be doing your visit today. I'm going to start by asking you a series of questions, and then I'm going to do an exam. So if at any point the exam becomes uncomfortable, you let me know, okay?
Okay.
Okay. So what are you here for today?
I just have a really bad sore throat, and I'm kind of not able to handle it much longer.
Okay, okay. Can you tell me when this started?
About 3 days ago.
Yeah, what does it feel like?
I don't know, it's like scratchy, achy.
Scratchy and achy?
Yeah.
Okay. Is it hurt to swallow or hurts to swallow? Okay. Have you had anything like this before?
Not this bad, no.
No? Is this on a scale of 1 to 10 for your sore throat? What would you say it is?
Maybe a 7.
7, okay. Have you looked in your throat? Have you seen anything on your tonsils?
I tried.
Uh-huh.
I mean, it's kind of hard to see, but I didn't notice anything. No.
Okay. It just looked, you didn't see any white patches or?
No.
Okay.
I mean, maybe a little red, but nothing. Like
Just a little
white
red.
or pussy.
Okay, okay, for 3 days, you got it. And it's mostly pain right here in your throat. Does it spread anywhere else, the pain?
No.
And so it's scratchy and achy. Is it worse when you swallow?
Yeah.
Okay, worse when you swallow. And so what brought it on? Did you just wake up with it one day, or what other symptoms have you had maybe?
I've just been really tired and exhausted. I feel kind of weak.
Okay.
And I've had a fever.
Oh, okay.
Yeah, I think the highest I took was like 101.
Oh, 101.
So
When was
it's been
that?
Around 101. That was last night.
Last night. And have you had a fever all 3 days, or just, would you say?
The last 2 for sure. I'm not sure about the first day. I didn't take my temperature the first day.
Okay. So fever 101 last night. Today you have a temperature of 100.2, so you still have a fever. Have you taken any medications?
I've tried like Dayquil and Jambide and NyQuil at night.
Okay.
That doesn't really help all that much.
Does it bring the throat pain down at all?
A little bit.
A little bit.
I still feel it.
And when was your last dose?
Last night I didn't take it this morning.
Okay, so last night. We asked that because it has Tylenol in it and it'll bring down your fever, so I just wanted to know when the last time you said you took it. So, usually people have a sore throat like with a cold, so do you have a runny nose? You do have a runny nose, okay, and did that start with the,
Yeah, it all kind of started with me like, I'd say like a 12-hour period.
okay. What about, does your face hurt? Do you have nasal stuffiness or just runny?
It's mostly just runny.
Runny, and what colors, let me guess?
That comes out of my nose?
Yeah.
It's
Blow it.
clear.
Clear, okay. Do you have, a cough?
Yeah.
Okay. Is anything
It's
coming
like
up?
intermittent, but no, it's dry.
It's a dry cough, okay. Is it worse in the morning?
Yeah, a little bit.
Okay. Sometimes when you get, postnasal drip, it drips down and can cause that, but, so you have a runny nose, fever, cough, and very sore throat. Is anyone around you sick?
Not at home, but at work. I'm a teacher, and some of the staff and some of the students have been sick.
Okay. So your teacher, what do you teach?
English.
English. At a, high school or middle school? High school, okay. So you're exposed to a lot of different students and stuff, and people at school are sick, okay. Okay. And, just so I know, who do you live, are you married? Married, okay, and do you have children at home?
2.
2 kids, how old are they?
15 and 17.
Okay, and they feel well, everyone feels okay?
So far.
Okay, and anyone else living in the home? No, okay. I'm just gonna get an idea of your past medical history so I can help connect this together. Do you have a history of diabetes? Hypertension? Hypercholesterol? High cholesterol? No, any chronic illnesses? Asthma?
No.
No? Okay. Do you take any medications other than your Dayquil and NyQuil? Do you take any daily medications? No. Have you ever taken any daily medications? No. No, okay. Do you take any herbal remedies, like anything over the counter besides Dayquil and NyQuil? No? Okay. And have you ever had any surgeries?
I had my appendix taken out when I was like 22.
Okay. Appendectomy. Have you ever had any plastic surgery, anything like that with your eyes, LASIK, anything like that? Okay. And any injuries to your face, your neck, nothing like that? Okay. When was your last period?
About 3 weeks ago.
3 weeks ago. And any chance you could be pregnant?
No.
No? No?
My husband had a vasectomy.
Husband had a vasectomy. All right.
2 is plenty.
Yeah, 2 is good. Okay, any allergies to medications?
Not that I know of.
Any allergies, environmental allergies like to cats or grass or, no, nothing like that? That makes you sneeze? And any food allergies?
No.
Okay. And when's the last time you went to the doctor?
Probably about 8 months ago.
8 months ago. What did you have a physical? And everything was okay? Okay. Up to date on your pap smears? They're normal? Okay. Tell me about your family history, your mom and your dad. Are they alive and well?
My dad passed. My parents divorced when I was young, so I don't really know much about him.
Okay.
Story or anything.
Do you know what he died from?
I don't.
You don't know what he died from, okay. What about your mom?
She's 80, and she's alive. She's well. She doesn't live in the area, so I don't see her very much. But
She has
we talk on the phone.
diabetes, high blood
Okay.
pressure.
She's fine.
She's good. No medication. No, okay. Do you have siblings?
No.
No siblings. Okay. Did in the family that you know of any cancers, heart attacks? Very blessed. Okay, and then do you exercise?
I don't go to the gym, but I go for a pretty good walk, like maybe 3 times a week.
Have you been able to exercise since you got sick? Because you just feel too cruddy. Okay. And do you drink any alcohol?
I do.
How much do you drink?
I usually like a couple of drinks at night.
2 a night? What do you drink?
Usually red wine.
Red wine. So 2 glasses a night?
Mm-hmm.
Have you, how many years have you been doing that?
On and off, probably about 10, 15 years.
Okay. All right. Have you ever, with that amount of wine, have you ever felt the need to cut back on it?
No.
No? Okay. Has anyone mentioned your drinking? Does that annoy you? No? No one's mentioned it? Do you ever feel guilty for drinking?
I don't know. I mean, there are times where I wonder, like, if it's healthy, if I should keep doing that. I mean, they say 1 glass of wine is good for you. I usually have 2.
Yeah.
But I don't know. I mean, I never feel like I'm getting drunk or anything.
Okay.
So.
Okay. Maybe sometimes you just wonder. Okay. And then you don't use it in the morning when you wake up to
Oh, God, no.
Yeah. Okay. We asked those 4 questions. If people answer yes to more than 2, we worry about alcohol dependence. I would try and recommend decreasing to trying 1 glass a night. Yeah. Just we don't know the long-term consequences can be for 2 a night can be somewhat valid for you. So I would reduce that. Do you smoke cigarettes?
No.
Have you ever smoked? No. No. Does anyone around you smoke? Your husband smoke?
No.
No? Okay. And do you do any kind of drugs, marijuana, cocaine, speed? What else is out there? What's the new one? Fentanyl?
Bath salts.
all the teens at your work are doing. What? Tide Pods, yeah. And have you traveled recently?
I wish.
No travel. Only in the summer for teachers, right?
Right.
Okay. And lastly, I just want to know, you are having body aches, is that right?
Yeah, it's just like, I can't really pinpoint. It's just like everything feels weak.
You just feel weak and achy. Okay. Have you lost or gained any weight in the last 6 months without trying?
No.
No. Okay, no weight changes. Any night sweats? Have you had trouble with your secretions, like you can't swallow them or you're drooling?
No. I mean, swallowing is kind of hard, but it's just because it hurts.
It's not like you choking on it.
No.
Have you had a change in your voice?
I don't think so.
No. And you don't have any family history or personal history of thyroid problems? No one's had a big thyroid, or no one's ever told you you have a big thyroid? No. Okay. Any headaches?
Mildly.
Just
but not
mild.
really.
Okay.
It's just 'cause I'm tired.
Any dizziness?
No.
Any chest pains, heart palpitations? No. Difficulty breathing? I know you have a cough, but do you feel short of breath? Like where you're really winded recently?
I mean, I feel like activity makes me a little bit. I mean, it's not like I can't breathe at all, but I feel it, and I usually don't. If
Okay.
I go up a flight of stairs.
Okay. But just since you've been sick the
Yeah.
last 3 days. Okay. And any nausea, vomiting, diarrhea? No? Any swelling to your legs?
I don't think so.
No? Okay. I think what else I want to ask was sore throat. Any uncomfortableness in your abdomen? Like you feel, no? Okay. And have you ever in the past, like maybe when you're in college, had mono, or is this the worst sore throat of your life?
It's pretty bad, yeah.
Pretty
I've
bad?
never had mono either.
Okay. Okay. Anything else you want to tell me about your sore throat before I examine you? Okay. Okay. Very good. All right. Well, I guess I'll start my exam if I think of anything else to ask you during the exam. So I'm just going to start by, sorry.
It's okay.
Any pain to your head?
No.
Is this painful at all here? No. Painful here? No. Good. Okay. I'm going to look in your ears. Does this hurt when I pull in your ear?
No.
Does it hurt when I push in your ear there?
No.
Lovely eardrum, nice and bright. Does it hurt when I pull?
No.
When I push?
No.
Yeah, very good. Okay. I'm also gonna look in your nose if that's okay. Right there. Good, okay. And then I need to grab a tongue depressor. Good, here. Okay. Look in your mouth. Can you say ah? I don't want to gag you, but okay, say it again. Here, can you lift up your tongue? Good. Okay, this way. Good. Okay, your lips. All right. Look at your eyes real quick here. You notice your eyes red? Can you look up for me? Good. And then down. Good. Okay, I'm gonna feel the nose around your face. Okay. Any pain? Is it okay if I untie your gown a little?
Sure.
Okay. Is this painful back here?
No.
Have you noticed any lumps here above your clavicles? No. Good. Okay. All right. That's good. So eyes, ears, nose, mouth, throat. I'm just gonna feel. Make sure your thyroid's not big. Okay. Can you swallow for me? It hurts, huh? Oh, sorry. Okay, good. All right, I'm gonna listen to your heart and lungs. Make sure you don't have anything going on here. I'll start in the front here. When you feel my stethoscope on your chest, just go ahead and take big breaths in and out, okay? Hang on a second. It's so cheap. Okay. You're not gonna say that for real. I'm gonna get under your breast. Do you want to lift it up yourself, or do you want me to do it here? Other side, actually. Good. Okay. Good. Okay. Other side. Give me the skin here. Good. Okay. I'm just gonna lift up under here. Breath. Let's see. Sorry. Good. Okay. Big breath. Good. Get all those lobes here. I'm gonna listen to the back. No, maybe you can just, for purposes of showing this to them. There we go, perfect. Okay. 10 minutes. I won't torture you, don't keep breathing. 2, 3, 3, 4, 4, 5, 6, 7, 5, 6, 7. Okay, all right, very good. Okay, come back around. I'm actually going to feel your belly to make sure you don't have anything down for me. Okay, by your side. Just going to look real quick at your belly. And you haven't had any nausea, vomiting, or abdominal pain? No? Good, okay. Or diarrhea? Been eating okay? Your appetite been okay?
No, I haven't really had much of an appetite.
Do you follow a special diet at home?
No, I mean, we ate pretty healthy, like lots of vegetables, proteins.
not a lot of sugar or salt. But I just haven't been hungry. And then it hurts to swallow, so I just not been eating as I used to.
Okay, I'm gonna have you take a big breath. Okay, another big breath. Good. I'm just feeling for any big liver or spleen. And I don't see anything. Good. Okay. All right, go ahead and sit up for me. And then hang tight. Cut camera.
Okay.
Then the preceptor, what do you think it, what are 5 things you think it could be? Go back in with your preceptor, you review it, tweak it, come up with a diagnosis and a plan. That's the first day of clinical. You have to be safe to take a nice history and an appropriate physical. That's the point of this class. And you will be ready. Okay, so I'll tell you what it says after. Okay, thank you. These are your findings. Very good. I think that concludes my exam today. Is there anything else you'd like to tell me before I go talk to my preceptor? I see that you do have some swollen nasal mucosa, and it says your throat is not with any white patches, but you do have swollen lymph nodes here. That's what I'm finding, and that you do have some clear discharge. So, is there anything else you'd like to tell me before I go talk to my preceptor and we come back and tell you the plan? Okay. All right. Well, that concludes my visit, and thank you so much for letting me see you.
Thank you.
Okay.
Yay.
All right. Before I let my actress go, do you have any burning questions for her? Do we need her anymore? Let me think.
Do you really have a bad cough?
I know.
No.
She's a good actress. She's good, right? She's good. Okay. Let me let her go, and then we'll debrief. Okay.
Thank you.
Okay, so that's the $1,000,000 question. Once you pick out, okay. Let's go through each thing, and I'll tell you what I was thinking. But maybe that would help the most. But this is why you need all this practice, because yes, what do you know how to do a full lung assessment, but what do you pick out to do? So I didn't, because her lungs were clear and she has no history of anything. So to take all the time to do, symmetric expansion, percussion, palpation, and I just did auscultation. In a real world setting, you would with clear lungs and no history. I don't know that other providers might totally disagree, but honestly, you don't see a whole lot of people percussing for a healthy person with a sore throat.
And why did you percuss the
Because I asked her with mono, I was looking for hepatosplenomegaly, and that's my way of checking the liver edge. That's why. So that's where it gets hard, because you've learned how to do a thorough body part assessment. So what do you pick out to do for a focused? That's where it gets hard.
And we're not having to explain during, like, remember when we first did the test to get into the class, we're not having to say what we're looking at the whole time, are we? Or we're just doing it as if it were a real life assessment. We're not going, oh, I've done this or I've done that, narrating as we go, right?
You can say, you tell the patient what you're going to do.
Okay, but we're not saying as if we're narrating it to you.
No, it's kind of hard because we give you a findings card. So like I was looking in her ears and they were perfect, but what if I hand you a card that says her ear is red? So more so we want you to say, okay, I'm going to touch you, and like I said, does this hurt or does this hurt? I'm going to look in your ears, I'm going to look in your nose, that kind of thing. So just more talk to the patient about what you're going to do. Okay, so I started with the history of the old cart. I probably jumped around a whole lot because I like to kind of get to the meat of things first. So I don't know, I probably jumped around a whole lot. I didn't stick to a lot of the scenario. I know I jumped around, but that's my way because I want to know kind of who they are before I start working up the symptoms.
What was the connection between the thyroid and cough?
If you have cybermegaly, it can trigger a cough. Yeah. So that's where also knowing your differentials comes in. So probably, honestly, your big key thing in all those 9 chief complaints is get to know so write down lots of differentials for each one, because one of the differentials was thyromegaly triggering maybe part of the cough, or it can cause sometimes a sore throat. So that's why I was ruling out her thyroid. So for each of the 9 complaints, get to know your differentials so that you know what to ask, because the differentials drive what you're asking. I thought of mono. Mono is typically the worst sore throat of your life. It's typically crowded, living in crowded environment, which is why I wanted to know if anyone else lived with her. And so because I had that as a differential, that drives all your asking and your associated radio systems. That's like the key to health assessment, I think, is knowing your differential so you know what to ask. I don't even know every differential for everything. So that's why it gets hard. You don't know what you don't know. And so that's why knowing red flag differentials is helpful. I asked the trouble with secretions, the drooling, muffled voice, because that's a differential for epiglottitis, peritonsillar abscess. So that drives those questions. The thyroid drove, family history of thyroid, personal history of thyroid. Has anyone ever had a big neck? That drives those questions. And then I did my associated review systems at the end. To me, that makes more sense because you kind of have a picture of who she is. Then are you having, but it doesn't have to be that way. Every provider does things differently, but that to me makes the most sense to ask them at the end, because you kind of get a picture of who they are and can ask questions, but you can put them right after the HPI too, that's fine. And why did I ask about her period? Why did I even care?
I'm gonna put her on.
Yeah, in case I give her antibiotics, I want to know if her husband's had a vasectomy. Am I worried that she's trying to get pregnant, or nope, she said I have 2 kids, that's enough. So end of story on that. At 40, she could totally be trying to get pregnant. What if she doesn't have any kids and she wants to get pregnant? Then you would want to look up your pregnancy category of whatever you're giving her to make sure it's safe, just in case. And say if you're trying to get pregnant, it's up to you if you want to take these. It's generally safe, but this is what's going on. So what else? And then associated were, so what the biggest differentials is like, you know what I forgot? What did I forget? Yeah, I
It
forgot.
sound like you're getting at like the hoarseness and loss of weight. I was like, oh, she's doing all her TB assessments.
Yeah, though, did I ask her if she had a PPD or a flu shot?
No.
Totally forgot that. So that I missed.
Yeah, that's night sweats though.
That's night sweats. Not if everything else was, no, because we've had students miss a category, but as long as everything makes sense and the symptoms make, physical makes sense for the history, we don't fail off one missing thing. But that would have been very good if I had asked flu shot.
And that only really matters because she's coming in with possible upper right? If it was abdominal issues, you're saying it wouldn't matter if you asked about food.
Right, so one of the differentials would be influenza. And so, that is something that would have been very important to ask. Flu shot, you can still get it having the flu shot or not, but with fevers and sore throat, body aches, influenza is a big one. And so viral URI, yes.
So I've gone in for sore throat, and they don't ask me for my family history.
Yeah.
Is that just because of the OSCEs, or would you typically go into family history and do something like that, sore throat or cough or?
We do it very thorough here, so you learn.
Okay.
You'll pick up what you need to do at certain places, and it depends on if you've seen them before you have it in the chart. If you're working urgent care and you think it's associated or related, then you would ask. For this one, because I was worried about her thyromegaly, to me that was appropriate. But does it matter that her mom and dad are alive and well? And I mean, you have to choose if that matters, but we do teach you more on the thorough side, so that you can back it up as you need to.
And do you only ask about mom, dad, or also siblings?
Yeah, mom, dad, siblings, and then, so 1 or 2 generations up and then lateral too. Yeah, she didn't have any siblings. Yeah, so I forgot my health maintenance, which I wrote down, but I didn't, I wrote just the section. And I asked her when she went to the doctor and everything was fine, but I did not ask her, vaccine, so that would be something that I would then, whoever was debriefing me would say, you did fine, except you forgot to ask these 2 things, and I go, oh. So, as long as, you know, it's a safe, I don't know if that's even, if everything matches up, if it's a concise physical for the history, and, it flows well, and most red flags were obtained, then it's passed, yes.
I mean, like, in clinical practice, maybe I shouldn't ask this. So she works at a school, could you gather that she's probably not speaking nice for certain things because she works at a school where that's never saying the same?
You can't assume, because what if she's total anti-vaccine?
Yeah.
Yeah, and some nurses don't want to get it either, so I wear masks, but,
So always ask all their immunization histories.
well, ones that are, would be appropriate, so I wanna know so much about her tetanus, not so much, I'd wanna know about her flu mostly.
So the health maintenance, what questions should you have asked?
When was her last flu shot and PPD?
So you didn't have to ask like a child.
No, no.
Okay.
So that's where these focus get hard.
Okay.
You have to pick out of everything you've learned in this class and how to apply it focused to the chief complaint. And so that's why we look for going down too many rabbit holes. You know, if you take 18 of the 20 minutes, you know, can you tell me your Hep B series as a child? You know what I mean? Like going down those kind of rabbit holes, then no, you know.
Sink trap.
But a general overall history of the
Time trap.
yes.
Or no matter what income you do, we still have to do like cardio and respiratory, correct?
Yes, yes.
So even though we
Back pain?
like 2 minutes of your, because you have to do full breath in, full breath out for each of those, what, 18, 16
To be thorough, yes, we've decided for every chief complaint. But that's why I wrote on your OSCE expectations, basic heart and lung. If they're, okay, so they're there for a cough, you're not just gonna listen, then you'll do the inspection, palpation, percussion, auscultation, symmetric expansion, all that, maybe some special voice tests, if you're looking for COPD. So then you would do everything versus just listening. I just listened because, I knew that the finest parts of the lungs were clear, so I just listened. But even with a sore throat and no past medical history, no smoking, I wouldn't necessarily start percussing and do all the advanced tests because that's not necessary.
But the basics respiratory is full auscultation.
Yes.
All the
Inspection, I guess I could say, you know, chest diameter was 2 to 1. I could have said that out loud. And auscultation of all the spots. But like I said, if it's cough, then you're looking at full. And if it's eye, so I only looked at her conjunctiva and sclera. To me, I just wanted to make sure she didn't have a conjunctivitis going on with what I was thinking was a cold. Conjunctiva and sclera. If she had an eye complaint, would I have done? What if you saw me for this doing all the 6 cardinal fields of gaze, confrontation? You know what I'm saying? Fundoscopic, Snellen. That's what I'm talking about, a rabbit hole. Like, don't go down that. Even though we've taught you all of those eye things, those are not appropriate for a sore throat.
Just because you
And
can
that's what you
doesn't
have to
mean you
start
should.
picking out, and that's what these next few weeks of practice will help you, because you'll be doing these scenarios, and then you'll come get myself, Professor Lamb, and say, this is what I did, and then we'll say, what you think best. Yes?
Okay, sorry, I was probably gonna hate me, but she had a cough, and
Yeah, you're right about that. That was a little off, but they were meant to be clear, so. And if you get a findings card and it doesn't have what you think, then just assume it's negative. Like her findings card was just, swollen nasal mucosa, clear nasal GC, and tonsillar lymphadenopathy. So I have to assume the heart and lungs were normal and everything was normal. Thyroid was normal. We're not gonna put all the normals. But if you have, the problem is if you get to your 20 minutes and you give this at the 20th minute, then you have to leave the room. If you have 2 minutes left, you go, you know, is it okay if I check one more thing? We'd rather you just can't leave the room and then come back. You have to kind of think. And it's okay to sit down for a minute. Yeah, it's okay if you say to the patient, you know, I'm just gonna go over my notes. I have a few minutes left. Let me just make sure I got it.
Okay.
And how long do we have to write it up?
20 minutes.
And what would you write for your assessment for that?
Pharyngitis.
I'm sorry, can you explain the finding card one more time? So what do you mean?
Pass it around, yeah.
Oh, yeah, it's just, it's so good.
Wow.
No, you need it after the physical.
At the very
Well, at least there's no plan.
After the physical.
Can you imagine walking in,
Oh,
this physical is
yeah.
over, and she hands it to you?
Gives it to us.
The extra.
Start.
So she was supposed to have it tucked under her. I forgot to give it to her.
Okay.
Yeah, so
So do we say I am?
she'll say, oh, I see you out here ready or drop.
Yeah. How does she know when we're done though? How do they know when we're done?
They're well trained enough to know.
And this is a cue for us, in case we're going the wrong way, to help redirect.
It's just to guide you on what they have.
So we have a few more.
Yeah.
They're not gonna
You've
give
already
it to you
assessed.
when you have 2 minutes left. Like they have to know that you're completed what you think you need to do.
Okay.
If you get the card and you're on point, you're like, okay, cool, well, I'll talk to my preceptor and I'll.
Yeah.
Or if not, that gives you clues to what maybe you missed or you weren't anticipating, then if you have time, you can go back. If you get that, you miss stuff, you're out of time.
So we have to indicate, or they may know, okay.
And otherwise, the card then is just to help you formulate your assessment.
It gives you your findings.
Yeah, your
What you
findings,
would
right.
really find in this case. So I would suggest, based on what I missed, maybe to write your differentials on this cheat sheet. So I should have put differential of mono, flu, viral URI, and then that would have maybe triggered me to ask that. But, maybe that would be helpful.